Welcome to The Explainer. There's a health crisis affecting millions of kids across America, and it's happening in plain sight. We're not talking about a new virus, but something much more common: tooth decay. Today, we're taking a frontline look at this quiet problem and a really unique solution that's being tested, not in a hospital, but right down the school hallway. Let's start with just one number, because it really sets the stage: 13.2%. That's the percentage of children and adolescents in the United States with untreated dental decay. Think about that for a second. That is more than 1 in every 10 kids walking around with a totally preventable disease, one that can cause pain, infection, and make it tough to even pay attention in class. But here's the thing, this isn't just about cavities. That number points to a much, much bigger issue in our country: a deep divide in who can get basic dental care and who, well, just can't. For a lot of families, a trip to the dentist might as well be a trip to the moon. The hurdles are huge. You've got money troubles, or maybe there just isn't a dentist for miles. Sometimes there are other more urgent health problems to deal with. And then you add language barriers on top of that, or maybe just not knowing that a toothache is a big deal, and that gap gets even wider. And this is where the data shows you the sharp, really inequitable edges of this divide. These barriers, they don't affect everyone the same way. The burden of untreated tooth decay falls so much heavier on children living in poverty and on Black and Hispanic kids. It turns a health problem into a serious issue of equity. So all of this leads to a really fundamental question for our entire healthcare system. If the kids who need the care most can't get to the clinic, is there a way to bring the clinic to the kids? Well, it turns out one of the most promising answers is unfolding in schools all over the country. The idea is so simple, it's brilliant. If kids can't get to the clinic, let's bring the clinic to them. Let's turn a small space in the school into a new front line for healthcare. They're called school-based health centers, or SBHCs. And yeah, they're pretty much exactly what they sound like: clinics that operate right where kids spend most of their day. We're going to zoom in on a program in New York to see how this model actually works on the ground. And get this, in just one school year, the 2024-2025 year, this program gave on-site dental treatment to 13,555 students. For so many of these kids, the dental provider who sets up shop in their school, that might be the only one they ever get to see. So, what does this care actually look like? Are we just talking about emergency visits for a bad toothache, or is there something more comprehensive going on inside these little school clinics? This chart right here really shows you their whole philosophy. Look at the numbers. A whopping 84% of students got counseling on what they eat, 78% had an oral exam, and 65% got a cleaning. Now, kids often get more than one service, but what this really screams is prevention, prevention, prevention. They are trying to stop problems before they even start. Okay, so we know what they're doing, but who are these school clinics actually serving? This is where the demographic data tells a really fascinating story. Just take a look at the age difference here. While the regular school health clinics serve all kinds of students, the dental services are laser-focused. A massive 67% of their dental patients are between 4 and 10 years old. And that's absolutely critical. It's the perfect window to set kids up for a lifetime of good oral health and stop major issues before they take root. But this slide right here, might be the most powerful piece of the entire puzzle. When you compare the insurance info for all the students using the health centers versus just the ones getting dental care, something just jumps off the page. The percentage of students with missing insurance information more than doubles. It goes from 26% all the way up to an incredible 58%. And that 58% isn't a data error. It's not a typo. It's a story. It tells us that these school clinics are reaching the most vulnerable children. Kids whose families might be undocumented or in a tough transition or just so far outside the system that they don't even show up in the data. This is what a real healthcare safety net looks like in action. So this New York model is clearly making a huge difference. But as we look to the future, there are some pretty important realities we have to consider, both for this program and for the whole country. And to be fair, the researchers behind this report are very upfront about its limitations. This is really just an early look. The data was collected as part of a much broader health project, so it's not the full picture just yet. What that means is the numbers we're seeing probably undercount the total amount of dental care that was provided, and they're still working on getting all the metrics the state requires. The team is already working to fill in those gaps so we can see the program's true reach. Now, let's zoom out from New York for a second and look at the national picture. The success of these incredible school programs depends on having enough skilled professionals to staff them. But that's where we hit a potential roadblock. National reports are raising a red flag. The country could be facing a shortage of dental hygienists, with a lot of burnout and folks leaving the profession. And all of that leaves us with one final and really critical question. We've seen how these school clinics can be a powerful lifeline for thousands of vulnerable kids. But as the need for this kind of care keeps growing, can a school-by-school solution, staffed by a workforce that's already under strain, really scale up to solve a nationwide problem? The answer to that is going to shape the health of a whole generation.